Good afternoon. Thank you for tuning in today to our quick virtual care webinar. Today we're going to talk about solving a virtual care myth, particularly looking at patients are uncomfortable with virtual care. And what we're going to look at specifically is the patients don't really like having their information on the internet. The idea that is true, but it's actually not. So we'll look into some of the statistics around that. We will be taking questions, so you can fill those into your GoToWebinar panel throughout the presentation, and we'll get to as many as we can at the end. Before we start, though, just quickly, audio settings. If you cannot hear us, we recommend you use computer audio, or you can dial in. If you're not hearing anything, maybe you have no audio selected. So just make sure you've got the right audio settings there in your GoToWebinar panel. With me today, as usual, is Mark Ayer, Director of Customer Operations. Mark has been working with SecureMail customers for quite a number of years and has a great understanding of how SecureMail is used in practices across North America and lots of different types of practices as well. So Mark, are you there? Yep.
Yes, I am. Thanks very much, Jeff. I'll let you do the first part, and I'll come back later on and show a live demo. Okay.
Perfect. Yep. So as I mentioned, we're going to talk about the myth that patients aren't comfortable with their health information being shared electronically between doctors and other healthcare professionals. So that's kind of an idea that has gone out there. I think the reality is, though, it might even be the opposite. Patients are quite comfortable, and it's clinics that get a bit uneasy because in lots of different healthcare professions, or the healthcare profession generally, we've been told for years that you cannot share information. It's against privacy regulations. It's not safe. And so what sometimes happens is people kind of default to, I'm just not going to use it to protect myself, but it's not actually a great protection. And now, especially, the shift we've seen in how practices operate these days, virtual care and remote access, different connections are really a requirement of running a practice these days, and are certainly becoming an expectation from patients. So there's lots of information and lots of statistics, lots of research and study into this. So we know that, and some of these statistics are coming from different places. Some of these are from Canada Health Info, if you want to check those out. Some of them are for different research papers. Some of them are for research we've done ourselves. We do have about 80,000 patients on our system that we do talk to on a regular basis. We do send surveys out to patients just to kind of get their sense of what they like about using SecureMail, what they don't like about it, what their concepts are of virtual care, that sort of thing. So patients agree that they know the healthcare professionals need timely access to care, and they agree that digital health is a good way to do that. Sharing health information electronically does enables Canadians to receive better quality of care. So there's lots of research that shows digital connections with healthcare providers does improve patient healthcare outcomes. 76%, so over 3/4 of patients who first saw their lab results, even without a consult first or a medical professional explaining them, were able to interpret the results and understood what was going on there. Especially true of chronic care patients who are doing that sort of thing regularly. They're used to the different markers they're looking for, all that sort of stuff. And it's about the same number, 3/4 are not comfortable sharing health information using traditional email. So when we ask patients, what do you think about email? A lot of them say they are aware of the risks of email for private information. We don't send our credit card information across the internet, but sometimes we do send patient information. As a note, some clinics do try to use email for the sake of convenience, and they'll have a waiver form, a consent form at the beginning when a patient comes to their clinic saying, hey, you authorize us to send your information via unsecure means like email. Patients don't actually have the authority to absolve you of your responsibility to protect their information. So it doesn't often stand up when clinics have to go to court maybe and stand up and say, but the patient said I could. The patient didn't write the laws. So we need to make sure that you're using secure ways. And patients do expect it. When we talk to patients, they do say, we really like that SecureMail is secure, that it keeps my information confidential. We get lots of notes from patients saying, "Hey, thanks for keeping my information safe," and we know that clinics do as well. We know that about 42% of patients say they don't leave appointments with all the information they need. So having some way to follow up securely with, hey, here's the things we discussed in your appointment. There's research out there from Kaiser Permanente, looked at 35,000 patients over some time, and found that having that regular communication helped improve patient outcomes because it helps with treatment adherence. So if there's something they need to follow up, maybe you've pulled a tooth and there's some infection control issues that you need them to be aware of, sending that information through secure mail is a great way to have the patient have a reference that they can look into, so they don't have to call your clinic if it's 9:30 at night and they're having some pain and they realize, oh, I didn't, what should I do? Oh, I have that note from the clinic that suggests here's the things you need to do to look after yourself and recover quickly. They can just reference the message, and a lot of patients do appreciate that. We've done webinars with patients about how they like to use secure mail, and that was one of the big things that came out of it. Was I really like the fact that I can always just look back at my notes. It helps me kind of not pester my clinic when I have easy questions about something we've already discussed. And the other thing around virtual care and digital communication is that we've seen and we've heard from patients, almost 75% again believe it's very important that they are included in communications between their provider. So Mark's actually going to show how that can work using secure mail, and we do have a number of clinics that do operate that way when they're referring clinics or referring patients to other clinics and specialists and back and forth. Including the patient on the communication actually improves efficiency quite a bit. And we have one clinic in particular that has reduced their patient wait times by more than 90% by including the patient on that initial intake referral request, so that they can ask the patient some questions up front and get the information they need to get the patient moved through quickly. So, secure mail for continuity and security, what it does is there's lots of tools out there now on the internet that say, hey, you can connect with a doctor or a clinician, but it's not necessarily yours. And you want to make sure that you maintain that relationship with your patients. Giving them this remote access means they don't have to resort to those other ways. It means they don't have to necessarily go to the emergency room. They don't have to go to a walk-in clinic if they can't reach you. One of the things patients really like about secure mail is that it's asynchronous. They don't have to wait for the clinic to be open. They can send you a message when a question pops into their mind, and they know that you will respond. So in that sense, it's efficient for everybody. Staff are pulled away from tasks less by the phone when it rings. Clinics, we talk about this almost every week. Clinics do schedule time to review the secure mail messages, because the great thing about email is that nobody expects an immediate response. So with that, I'm going to turn things over to Mark so that you have some time to go through things. Mark, do you want to grab control here
Yeah, sure
and
thing.
just go through kind of how you get information to patients, how you connect with other providers, and sort of build that sort of team environment where it's more collaborative and patients are engaged better?
Yeah, let me turn on my screen broadcast right now. So I'm going to do a live demo here, but the screen I'm showing right now is actually a video recording that I made on my iPhone a couple of days ago. So little different. If you've seen demos before, usually they're all live. This is actually a recording because screen sharing from an iPhone is a little bit dicey. But from a patient's point of view, what I'm going to show here is how, as a patient, I can use my mobile device, iPhones, Androids, tablets, and so on, work just fine. And what I'll do, I'll start the broadcast now and I'll kind of narrate as we go. As a patient, I can log into my secure mail account on my phone and compose a message to my doctor's office. Now, I'll pause it here in a moment to show you that when I'm addressing the message, I'm selecting that I'm sending the message to the doctor. So I want to send a message to my doctor. His name is Pierre Fauchard. And you'll notice that when I address the message, I get a warning or a notification from the system saying that messages don't go directly to the doctor. They're going to the clinic instead. And this is a very common concept that, of course, most patients already have in their minds, which is when they pick up the phone, and call the doctor's office, they don't expect the doctor to answer the phone. It's generally the front desk staff, medical office administrators, dental staff, whatever your practice might be. So the same concept exists here within Secure Mail, where as a patient, when I compose my message, I understand that it's going to the staff. And one question that comes up, not a lot, but sometimes is asked of me is, are patients uncomfortable sharing their health information with the staff as opposed to the doctor? And I have to say, unequivocally, they are not. I think most patients are very aware that everyone in in the medical office or the dental office, for that matter, is part of the healthcare team. Most of our patients don't have this concept that their information is just with the doctor. It is really with the clinic, and that's just the way healthcare has always worked. So I'll continue the little broadcast here. So now I'll just accept this little warning, and I'll go ahead and I'll address the message to Dr. Fauchard's clinic. And as I carry on now, just as an example here, what I'm going to do is take a photo that I want to share with my doctor's office. So here is a video. We're taking a picture of someone's hand or of my own hand, ostensibly, because maybe there's a lesion or a scar or some other damage that I want to share with him. For that matter, I could have taken a photo of a document or some other, a pill bottle that I wanted to send. Anything that I wanted to collect and send to my doctor's office, I can do in this fashion. So now I'll just quickly type the message. And when I'm done, I'll click send. And through Secure Mail now, we can deliver this message off to the doctor and they'll be able to respond back to us. So that's the end of the video. Let me change my point of view now, excuse me, over to that of the actual doctor, or in this case, the doctor's staff member. So if I resume the screen broadcast now, you should be seeing the login page for Brightsquid Secure Mail. I will quickly log in now as Clara, who is the office manager at the Fauchard Clinic. And when we log in as Clara, we're going to wind up at her Secure Mail inbox, showing all the messages that she's received recently. Now, most of you are probably familiar with our shared inbox, which is up here in the top left-hand corner. Just to illustrate for those of you who may not have seen this before, Secure Mail users generally have two inboxes at their disposal. My inbox, best described as your private inbox, which only you, or in this case, Clara, has access to. These are messages that are addressed to Clara and only to Clara. Conversely, in the shared inbox up here are messages that are sent to the practice. And the great thing about the shared inbox is this is where the virtual front desk really comes into its own, because this is where we're simulating that calling the front desk over the phone concept, where all of these incoming messages from patients and potentially even from other medical professionals all get routed to one central location. So in this case, patient messages is what we're seeing here. These are all the messages that have come into this practice in the last couple of days, and any or all of the staff that are assigned to this shared inbox can access and view this information. So what this really does, and Jeff alluded to this a moment ago, is that the doctors themselves are not being, shall we say, inundated or bombarded with incoming messages from patients. All of that, just like the phone system, is being handled by the staff, as it should be. And so our staff now can receive all of these messages. Here's another photo that I sent as another test a little while ago. Oh, that's very, that's very zoomed in. But this is where we can access the information, and then the staff member can make a decision as to whether to forward this on to the doctor, or reply directly back to the patient, or just log it into the practice management system or electronic medical record system. But the point is that it's the front desk staff that can handle most of these conversations and consult with or talk to the doctors later on as to what that information might be, or what the response might need to be. One more quick example here. Here's a question from Susan. She's asking about her prescription. It's causing me discomfort. What should I do? I think in this situation, with a specific medical query, we're going to forward this on to the doctor directly and ask Dr. Fauchard to respond. Oops, I spelled his name wrong. To respond back to the patient. So when I do this, we forward the message on to the doctor. The doctor sends a reply back to the patient. And if the patient replies to that message, guess what? That reply goes back into the shared inbox for the team to handle it again. So doctors can now have a, shall we say, a one-way conversation where they can send personal private information directly to the patient. But if the patient replies, we wrote that message in such a way that it's still handled by the team. So we found that this really takes a lot of pressure off of our doctors and other clinicians, and putting more of that day-to-day interaction with patients back into the hands of the staff who are more properly equipped to deal with that kind of a workload, and clinicians can continue clinicking, as they say. Anyway, that's all for today's demonstration. Jeff, if you want to resume the screen broadcast from your side, I don't know if we have any time to answer a couple of questions today or not.
Yeah, let me just get back in here. We actually don't today, so we were thorough. I will like, change the presenter back to myself. So before we go, we do have, like I said, lots of patients who are happy and excited to use Secure Mail. They find it to be very useful. They find it very, very easy. And they know that it's also helpful and easy for clinics that they work with. So patients enjoy being sort of a contributing part of the team. They know that they're doing good things for their health. They know that they're doing good things for the clinic as well. So, if you haven't done it yet, if you haven't signed up, you can also sign up for a Secure Mail training if you want to learn more in depth. So we do twice a week sessions at lunch on Tuesdays and Thursdays. You can go to the Secure Mail page on brightsquid.com and register for a more in-depth training if you'd like to see more about how to configure your virtual inbox, your virtual front desk with Mark. We do have those ready to go. You can sign up for those training sessions. I think the next couple of weeks are scheduled out, so you can go register for those anytime. You can also do a privacy risk assessment. If you haven't done a quick check on your privacy preparedness and how you can prevent breaches, you can go do that on our website as well at the link right there on the page. So thanks for tuning in today. Mark, appreciate your time as always, and we'll see everybody next week.
Thanks, everybody. Have a good weekend.